It is a joy of every parent to see their little ones have good health and be able to have a normal life just as other children of their age. For this reason, the Ministry of Health in Kenya is actively working to eliminate mother-to-child transmission of HIV, aiming to reach 0% by 2027. According to the National Syndemic Disease Control Council 2024 report on Kenya modes of HIV transmission, there has been a remarkable improvement in prevention of mother-to-child transmission of HIV coverage over years, from 31.1% in 2014 to 90.3% in 2023. This can be attributed to the increased uptake of prevention of mother-to-child transmission services and better antiretroviral therapy adherence among pregnant and breastfeeding women living with HIV. Kenya's effort aligns with the global goal of ending AIDS in children and includes strategies to reduce mother-to-child transmission of other infections like syphilis and hepatitis B.
Normally in the first visit, we do for them what is called profiling, whereby we do all the investigations. The full hemogram is done, HIV is tested, and syphilis is also tested. Given that we know that for the transmission to take place, even to the baby, if it is syphilis that the mother has, it has to be treated in time so that the transmission rate may be reduced.
The 2023 HIV estimates shows that most new child infections occur among mothers who drop off antiretroviral therapy during pregnancy and breastfeeding, accounting for half of all new child infections. Homa Bay County has the highest burden of mother-to-child transmission of HIV in Kenya, as some areas, among them Suba South, Beta and Dewa sub-counties, are remote or rural with low access to health facilities offering MTCT services.
Our county is divided into 9 sub-counties. The 9 sub-counties, 3 of them are landlocked. Dewa, where we are now, is one of such landlocked sub-counties. Dewa is low in terms of agricultural productivity and agricultural activity. And also, it is also very vast and has got a challenge of poor road network. If you look at our statistics as we speak today, mother-to-child transmission, which is women who are HIV positive passing the virus to their children, is high here. Why is it high here? It is high here because mothers here still depend on home deliveries because the poor terrain make them not access delivery in good time. And during the delivery process is when the women are able to pass HIV to their unborn children.
A few mothers who manage to reach health facilities are, however, able to receive services that help them prevent HIV infections during childbirth.
And also during labor and after labor, we also do the testing to find out whether the transmission has taken place, whether the mother is still positive, and we encourage them to take the drugs. For those who are positive, they are put on ARTs, and their babies are also given Nevirapine and Dovudine at the time of birth. So they are given those drugs during ANC period when they come to the clinic, so that when they come to deliver, they have the drugs with them in their bags. So that one reduces the transmission of HIV from mother to child. And again, when they go home, normally they come back after 4 weeks. We advise them to come so that we may do the test to the baby.
Speaking to journalists during a Media for Environment, Science, Health and Agriculture training on data visualization and infographics, Patriciah Jeckoniah, a policy lead at LVCT Health, stated that despite efforts and the now available technologies and tools to prevent mother-to-child transmission of HIV, infections of newborns still occur, ranging from 8 to 11%. This exceeds the global target of less than 5% by 2025.
The concern of mother-to-child infections. We have not really met our target of less than 5%. And in terms of even care and treatment, children, the coverage is about 66%. We ought to be at 95 at the very least. So it means that we have to get innovative strategies of how to get these children, work with their parents so that our children live a healthy life.
She says that the campaign against eliminating HIV is a combined effort.
When it's critical that we come together as Kenyans, as stakeholders, and have a discussion on what our HIV response should look like, given the funding cuts, what do we have available in the country, but also what sort of partnerships do we actually need as a country right now to be able to realize our target of making HIV not an issue of public health concern by 2030.
Reporting for Mesha, I am Christine Ochogo.